All right. And we're going to talk about kind of an easy drug here today. We're going to talk about tetracaine. Tetracaine is a very nice drug to have, especially when somebody's got something in their eye and you need to reduce the pain that they're having in their eyes. A wonderful drug for that, and hopefully your service does carry this. So again, tetracaine is it's got these different trade names, but the only thing I've ever heard it called is tetracaine. And so what we use it for is to numb the eye before surgery, tests, or procedures. I know that we use it a lot for if somebody has been accidentally sprayed with something in their eye to numb the eye, so it usually wears off about the same time. Pepper spray is the big one that we will use it. And again, it's a local anesthetic. It usually onsets very short acting, 1 minute or less it's in. Once you put the drop in there, it numbs it, and then it lasts for about 20 minutes. A pepper spray will usually last around 20 to 30 minutes. You might have to redose them if they start to feel it. And again, and they're able to, usually will flush the eye as well, and will numb the surface of these before we'll put in a Morgan's lens. And again, the Morgan's lenses are to help irrigate the eye. And again, as dumb as this sounds, it's not for IV injection. And I would hope that nobody ever tries to take and draw it out of the dropper area. Just don't do it. Again, it can cause a little bit of burning to the eyes when it's first put in. That's kind of a normal thing that will happen. And again, that you could have a little bit of a localized reaction. It could actually numb the muscles of the eye if it gets in there deep enough. The tachycardia is usually, I would say, probably from a bradycardia issue. Most of the time, you're not going to get these side effects with tetracaine. It's usually very, very safe. Again, if they're allergic to any of the cane medicines, I would probably stay away from this. And then again, if they have an allergic reaction to aminobenzoic acid, I would probably stay away from it. But again, that's a very, very rare thing to have. Again, it can cause a vagal effect again, because sometimes we're touching the eye, we actually don't realize that we're doing it. If the solution's got any type of crystals in it, if it's cloudy, discolored, it's kind of an obvious one. You don't want to use it. And don't rub or wipe the eye until the anesthetics wore off. So again, make sure that they don't touch their eye. You can't feel this thing. So again, you can sit there and press on your eyeball all day long and cause damage. Usually 1 to 2 drops is what we give them. We apply it, again, pull the lid down just a little bit. 1 to 2 drops in there. It works really good. And the same thing for a pediatric dose. And again, it's an ocular route. We want to use this in the eyeballs only. That's the only place we use this. All right, that's a quick overview of tetracaine, and we will see you next time.